Can you introduce yourself with your full name and your title here at the clinic?
My name is Annie Hernandez, and I'm a staff veterinarian here at Santa Monica Pet Medical Center.
Walk us through your journey from graduating college to becoming a veterinarian.
So I went to Stanford University and got a bachelor's degree in biology. Took 2 years off and worked as a vet technician in Simi Valley while I was pursuing getting into veterinary school. And then I went to University of Illinois College of Veterinary Medicine, and that was a 4-year program. And I graduated in 1998.
All right, let's do it. What's your favorite part of the job?
My favorite part of the job? Obviously working with the animals. That's I think why most of us go into the field. Being able to help keep animals healthy, help alleviate pain, discomfort, trying to figure out what's ailing an animal, and trying again to find the best way to make them well. And obviously working with people, not only with people that love animals, all the staff here, we all love our pets, and that's why we're all in the field, but obviously working with clients and who share our love of animals and treat their animals like family.
And what do you like to do when you're not at the hospital?
So, while I'm not at the hospital, I spend time with my daughter, Audrey, who is 11 years old, a 5th grader at a local school here in Santa Monica, and my husband, Tim. We enjoy outdoor activities like hiking and skiing and traveling, and I do try to exercise on my days off, and yeah, we try to stay active as a family.
What's something you'd like our clients to know about you or your care approach?
So I think a big part of our field is working collaboratively with our clients, coming up with a diagnostic and treatment plan that everyone feels comfortable with, discussing options with owners, because one option may not be ideal for one patient or client versus another, and keeping all things in mind, and coming up with, again, like I say, a plan involving the client with the testing and treatment options that we can give our pets to keep them healthy and to treat them when they're sick. So I think that's a really important thing, is to get the client involved so that they're comfortable and they know what their options are, and keep them educated on how we want to keep their pet healthy and comfortable and live long. Perfect.
And what's your knowledge on ultrasound?
So one a tool that we have here at Pet Medical Center is the use of a very good ultrasound, and Dr. George and myself both perform full ultrasounds here. Ultrasonography is a really important tool in helping diagnose certain ailments in pets. It is a non-invasive tool to help learn more about the internal organs of a pet. Certain things can show up on ultrasound that don't show up on an x-ray. We can learn about certain diseases and find answers to certain questions with ultrasound, things that don't necessarily show up on lab tests or, like I said, x-rays. So ultrasound shows things three-dimensionally. We can learn more about the architecture of certain organs. We can look for tumors. We can evaluate for fluid pockets in the abdomen or the chest, and again, see things that we don't pick up on other standard tests. So I think ultrasonography is one of our best tools to help diagnostics and treatment-wise for pets here in Pet Medical Center.
Boom.